Hi, Mr. Dave. My name is Uche. I'm one of the nurse practitioner student here
How
from
you doing, Ajay?
Metropolitan State University. I'm doing well. How are you?
Good. I'm doing good.
So today we're gonna be you're here because of health maintenance. Is that correct?
Yes, just the health maintenance.
Oh,
Correct.
okay. So we're gonna do some kind of a health history taking questions.
Okay.
I'm just gonna be asking you questions and you'll be responding. Okay.
Okay.
But before we proceed, I would like to do some kind of a quick assessment. It's called the ACE assessment.
Okay.
It just kind of tells us your early life before your 18th birthday,
Okay.
and it's not really something to worry about.
Okay.
So the first question is, did any parent or adult in your home swear to insult you or humiliate you when you were younger?
No.
Okay. The second question is, did any parent of yours or adult in the house often push, grab, slap you, or throw something at you?
No.
Okay. Did any adult or a person at least 5 years older than you are or you were at the time touch you inappropriately and you feel like you were not very comfortable?
No. Never
Okay.
happened. No.
Okay, the next question is, did you often feel very did you often or very often feel like you didn't have enough to eat at a time when you were younger or have enough clothes to wear?
No. We're
Okay.
well taken care of.
Okay. Were your parents ever separated or divorced?
No.
Okay. Was your mother or your stepmother often pushed, grabbed, slapped you, or threw something at you when you were younger before the age of 18?
No. That never happened in our household.
Okay. Did you live with anyone else who had a problem with drinking or smoking
No.
or use street drugs?
No.
Okay. The next question is, was a household member of yours depressed or mentally ill?
No.
Okay. Any suicide in the family?
No.
Okay.
Nothing like that.
Did a member or a household of yours went to prison when you were 18 years?
No. Never
Okay.
happened. No.
All right. Thank you for that
Sure.
answer. So now we're gonna move straight to the health history taken.
Okay.
Please tell me your age, please, and how you identify yourself.
I'm a 43-year-old African American male.
Okay. What do you do for a living?
Pharmacist.
Were you biologically born a male?
Yes.
Okay.
Identify as male.
And of course, you speak English very fluently.
Yes.
So I
speak
shouldn't
fluent
ask you
English.
that.
Yes.
So for the purpose of this visit, you're just here for health maintenance,
Correct.
right?
Just the
Okay.
health maintenance. Correct.
Please tell me more about your past medical history.
Yeah, so I'm type 2 diabetic.
Oh,
I've been
okay.
a type 2 diabetic for the last 10 years.
Okay.
I was diagnosed October 2009, so I've been on some medication. I have hypertension. That's the stage 1 hypertension.
Okay.
I was diagnosed in February of 2012.
Okay.
I also take some medication for that.
Okay.
I also have hypercholesterol, which
Okay.
I've been trying to control. That was
Okay.
also diagnosed the same time in February 2012.
Okay.
And I'm on some medication for that too. Then I have myopia. I started using prescription glasses in 2007.
Okay. And you mentioned that you take some medication. Can you tell me
Yes.
the medications that you take?
Okay. So I do take metformin.
Okay.
It's in 500 milligrams. I take that twice a day.
Okay.
I take Novolog, but I take that 4 times a day.
Okay.
But I need to check before meals before I can actually take the medication. Then I also take 20 units of Lantus at
Okay.
bedtime.
Okay.
Then I take amlodipine, I think.
Okay. I'm Lord. Okay.
Yes.
Okay.
that's
How
what-
often do you take that?
I take that daily.
Really? Yeah.
The dose is actually 10 milligrams.
10 milligrams.
Yes.
Okay.
Then I take a Lipitor. I take 20 milligrams at bedtime. Then in the mornings, I do take Centrum. I take just one. I take some fish oil. I'll say about 1,000 milligrams. Then I take Biotin, 5,000 microgram pills.
Okay.
I take that just once a day. Then I also take some iron supplements. I think the dose I take is 325 milligrams. I take that once a day also. Then I take a B12. I take that once a day.
Okay, B12 once a day. Okay.
Correct.
Can you tell me your allergies?
I'm allergic to peanut butter and fish.
Okay.
Yes.
All right. So currently you have diabetes. Is there anything else you have?
Yeah, so I have diabetes. Well, I've been trying to get my A1C goal
Okay.
to be less than 6.9.
What is it right now? Do you know?
Right now it's 9.5.
Okay.
It slightly came down a little bit by about 0.5, but
Okay.
I'm still trying to reach that goal of 6.9.
Okay. Which is the normal
Okay.
range that we want you to be.
Yes.
Okay. 6.9%.
Yes, that's been a work in progress.
Okay. Do you have any past history of surgery? Have you had any surgery before in the past?
Yes, actually, I had a right knee replacement. That was in 2013.
Okay.
I think that was April 2013.
Okay. Any past or recent hospitalization or injuries?
Well, the knee replacement I had in 2013 in April, I had some hospital stay.
Okay.
Then just this past month in October, I had a 5-day stay for, I guess, low blood sugar, hypoglycemic
Okay.
episode, something like that. Yeah, I had that in October, just late October, and I stayed in the hospital for 5 days.
Okay.
I was discharged on the 25th, so I must have gone in about the 20th.
Okay.
Yeah, so it was a
Just
5
5
stay.
days?
Correct.
Okay.
Yes.
Do you know why you had the knee replacement?
Oh yeah, so I've always been active in sports.
Okay.
I played sports in high school,
Okay.
then on to college. I also played some sport. I played football in college, but the pain progressed, and I finally just had to get the knee replaced.
Okay. So how do you feel about not being able to play sports?
It's one of those things that happened. It was not going to be for a lifetime, so I guess I feel okay about
You
it.
feel like any feeling of depression?
No,
Do you have a history of mental illness at
no,
home?
no.
Okay. Tell me about your sexual life.
So I've been married for 10 years.
Okay.
And my wife is the only person I've been with for the last 10 years.
Okay. Any contraceptive use? I know this doesn't pertain to you, but we just still have to ask.
Oh, sure. I don't, but my wife uses birth control since we had our last child in 2016.
But for you, you don't use any
No, for me,
contraceptive.
I don't.
Okay.
But my wife does.
Okay. I also know that this next question doesn't pertain to you because you are a male, but we still have to ask that anyways.
Okay.
Have you had any obstetric or gynecological procedure or visit done? Like women's visit to women's doctor?
Oh, except when I take my wife. But for me, myself, no.
Oh, okay,
No, I don't use that, no.
Okay. And you identify yourself as a male?
Yes.
Biologically
All male.
born
Yes.
male, okay.
Yes, I identify as male. Yes.
Okay. Can you tell me about your immunization?
I recently had a flu shot. Also last month, October 19th, I think. That was just before my hospital stay. Then I had some, I guess my tetanus shot, Hep A, Hep B, measles, BCG vaccine are all up to date, but I can't remember the date of the last set of vaccines I took. But I know the flu shot was just 19th of last month.
Okay. For this year?
Yes, for this year. And I take that every year.
Okay, good. Also, too, beside coming here for your health maintenance visits, have you had any other health maintenance procedure done in the past, or?
You know what? Yes, you know what? That brings in May of 2018.
Okay.
I remember I had a bloody stool which lasted for about 3 days.
Okay.
So there was a concern maybe I had something going on. So I had a colonoscopy done, and there was no polyps found. I was given the all clear. So.
Okay. So nothing was found with the results?
Correct. Nothing was found. So I guess I was cleared. Correct.
So when last did you had the bloody stool?
This was May 2018.
So it stopped?
Yes, it stopped.
Were you on anything? Did they give you any
meds?
medication? No. Oh, no? Okay.
No,
it just resolved on its own?
Correct. It just resolved itself.
Okay.
Yeah.
Okay, just a quick question. I know we did a quick ACE assessment. So in your childhood, you never had any, did you had any child abuse?
No,
or anything
never.
like that?
No.
Okay. How long were your parents? Can you tell me more about your parents? How long they were married and stuff?
Yeah, so my parents were married for 34 years.
Okay.
And I lived with them growing up throughout. I was born and raised in Africa. So,
okay.
Had I guess just everything was just regular, like a typical.
Did you had any childhood illness?
Anything other than malaria and jaundice, which was, I guess, happened in Africa. Yeah.
Oh, just the malaria and the jaundice.
Jaundice, correct.
Okay, yep. Which is pretty common over
correct.
there. Yeah.
Yep.
Okay, in the last 24 hours, can you tell me what you've had?
In the last 24 hours, I had brown
food,
rice, tomatoes, stew, and some goat meat.
Okay.
Yep.
What's your nutrition like at home?
My wife typically cooks, and it's mainly African meals. The rice, beans, goat meat, beef, and chicken. But sometimes if my wife is too tired to cook, it's a very busy household. We usually get fast food, maybe, and we usually just go for Wendy's.
How often do you eat fast food?
Not often, but just when we're too tired to cook.
Okay.
Yeah.
Like in a week, approximately how many times
I
in
would
a week?
say maybe once or twice a week.
Okay. Can you tell me about your cultural beliefs, like in terms of health?
I don't have any. No cultural practices, no. Just see my doctor on a regular basis. That's about it.
Okay. Do you drink or smoke?
No. The household we don't drink or smoke, so I don't drink or smoke. I don't drink coffee either. I don't use drugs. Then I guess I do try to exercise once a week as much as I can.
Okay, that's good. Anything else?
No.
Okay. All right. Tell me about your living condition and at work. What do you do? What's your work routine like?
Okay, so I'm a pharmacist, and I try to stand 10% of my work requires me to stand 10% of the time and sit in 90% of the time, but I did request for a standing desk because
Okay.
I do prefer to stand, is, trying to stay healthy.
Okay. How about home?
At home, I guess the household is just myself, wife, and it's a private home, so just myself, my wife, and 2 daughters.
Oh, okay.
And my daughters are in school right now.
Okay.
Yep.
What school? High school, elementary?
Yeah, one is in high school,
High
then the other
school.
one is in elementary.
Oh, okay.
Yep. Yeah, I guess that's what it's called, elementary, preschool. She's still just
Oh,
3 years
okay.
old, so.
Okay. All right. Tell me about your spiritual life, what you do, you and your family.
Okay, so I was born and raised a Christian, and we still practice Christianity. We go to church twice a week, Fridays and Sundays.
Okay.
Then I volunteer, my wife volunteers as well in church.
Okay.
We celebrate all the Christian holidays. My wife is my primary support system, and how my kids, they keep me going.
Okay.
Yeah, but I guess the main thing I have on my mind is my diabetes, this type 2 diabetes. I'm trying to see if I can get off the insulin as much as I can.
Okay.
And I'm believing God will be able to work his miracles and help me regulate my diet.
Okay.
Yeah. I'm trying to get to that 6.9 number.
Okay. That's good. That's a good goal. You're doing well.
Thank you.
Can you tell me the type of medical condition that your grandparents or your granddad or grandmom had in the past, and also what your parents had,
Okay.
and your siblings as well?
Okay, so I guess with my grandparents on my dad's side, my granddad, I didn't know him to have anything. He was about 92 when he passed. And my grandmother on my dad's side, she was also in her 90s when she passed. So I guess they were very healthy.
On your dad's side?
Correct, on
Okay.
my dad's side. But on my mom's side, my granddad, I think he was hypertensive. He passed when my mom was still young. But my grandmother on my mom's side, she was over 100 years old when she passed. If there's anything I remember, I think she developed late Alzheimer's, I believe.
Oh, silence. Okay.
Correct. Then my dad died, passed in 2007. He had hypertension and he was type 2 diabetic.
Okay.
My mom she's had a heart failure, and she also has hypertension because she smoked in the past before.
Okay.
And she also has arthritis in both knees.
Oh, okay.
Yes. So siblings, my sister is type 2 diabetic, like my dad, and she has obesity she's trying to deal with. My brother, just like my mom, also has a heart disease. He smokes, and he recently had a catheter ablation. And if I remember right, the doctor said he would need a left valve replacement.
Okay. Okay, thank you for that. So the
Sure.
next question is, can you tell me overall how you feel about life?
Overall, I would say
Yeah.
I'm very satisfied with life. If there's anything that I have on my mind, and I still believe in God, is to be diabetics free. And I'm just blessed and lucky. I have a very supportive wife, and my kids too are very supportive, even though the last kid is just 3 years old, but I think she understands. So they are very, very supportive overall. I take comfort in my religious beliefs, and the family dynamics are just very, very supportive and very encouraging.
Okay. All right. So the next set of question we're gonna do is just to ask you about a general question with regards to review of system.
Okay.
Okay. So tell me how you feel today.
Today, very happy. I'm very happy. No fevers. I didn't mention this. So in the last 2 months, I've lost about 15 pounds.
Oh, you have.
And
Oh, great.
that was as a result of exercise and trying to control my diet. That's why I guess my numbers came down slightly. So that's why I'm very optimistic I can beat this diabetes.
That's good. So no fevers, no chills.
Nope, no fevers, no chills.
Okay. Have you noticed any rash? Have you been itching a lot
No,
on your skin?
No.
Do you feel like you have some lesion, some kind of redness on your skin?
no.
Okay. So with your hair, have you had any recent hair loss or any changes that you can think of?
Well, no hair loss, but I do use Biotin, and I use a bunch of my wife's hair products, which, yeah, funny enough, has been helping.
Okay.
Yeah, it helps my hair regrow, I guess. So,
Okay.
yeah.
Any recent headache?
No, none.
Okay. Have you noticed any redness or abnormal drainage in your eyes, or have you been itching a lot?
No, none.
Any changes in your vision?
No, everything's just fine.
So your ears, do you have any pain?
No pain.
Any
in the ears.
hearing issues? Have
No.
you noticed any drainage recently?
No,
Okay. How about your any sinuses?
no, none.
Flu?
Nope.
Okay. Any pain? Nosebleeds?
Nope, no pain.
Okay. Have you noticed any difficulty with swallowing?
No, none.
Any soreness in your mouth or
No,
any
none.
lesion?
No,
Okay. Any toothache?
none. No toothache.
No toothache. Okay. Have you lost any tooth?
No.
Okay. Any pain on your neck?
No.
Any
no
lumps? Have you noticed any lumps?
No.
Any
No.
stiffness?
Nope.
Okay. Have you, I know this pertains mainly to women, but men can also have breast cancer issues. So that's the
okay.
reason why we ask.
Okay.
Have you noticed any lumps or bumps?
My breast?
Pain, your breast area?
No.
Oh,
None.
okay. Okay. Any shortness of breath?
None.
Any recent cough?
No.
Do you feel like when you sleep you have a hard time breathing?
No. None.
Okay. Do you sweat at night?
No. No
Okay.
night sweats. No.
Have you noticed any chest pain, palpitation?
No. None.
Okay. Do you have any swelling in your hands and your feet?
None.
Okay. When you exercise, do you usually have like cramping or pain
No.
when you exercise?
No.
How about numbness on your fingers and your feet?
None. No.
None?
No.
Okay. In terms of your abdomen,
Okay.
do you have any abdominal pain?
No. I don't have any abdominal pain. No.
Any nausea or vomiting?
Nah. No nausea. No vomiting.
Any GERD or how you eat? You have heartburn?
Heartburn? No.
Oh no. Okay.
No.
How are your bowel patterns?
It's regular. I would say.
Okay.
I guess bowel movement 3 to 4 times a day.
Oh, okay. Have you noticed any issues with voiding, like going to the bathroom to pee and stuff?
Oh, no problems peeing. No.
Okay. So your male genitalia area, have you noticed any Any soreness?
No.
Or abnormal drainage?
No.
Any bleeding?
No.
Any recent sexual disease?
No.
Okay. So have you noticed any joints pain, joint
pain?
stiffness?
No.
Okay. How about muscle pain?
No muscle pain.
Any weakness?
No. No.
Any issues with your gait
Gait?
in terms of balance when you're walking?
Oh, no.
No? Okay. Any recent falls?
No. No falls.
Do you feel like you have warmth on your knees and your joints area?
Nope.
Oh, okay. So you did said you don't have headaches. Have
No.
you noticed any dizziness at all?
No.
About weakness?
None.
Okay. Any numbness on your fingers?
No.
No? Okay.
No.
Have you noticed any bruising?
Bruising? No. I have no bruising.
Okay.
No.
About anemia?
What's the
Anemia is like you're not having enough blood in your system.
Oh, no.
Oh,
I think
okay. Of course, you take iron
correct.
too.
Yes. So that really helps.
Okay. So any recent weight gain?
Weight gain? No. No. Since I've
Okay.
been on this
Just
new
you-
diet,
Yeah,
so I've
recent
lost some
weight loss.
Yeah,
Okay.
the last 2 months I've been tracking.
Okay. Have you been having frequent urination or increased tastes?
No.
Oh, okay. Do you have any anxiety, depression?
No.
No.
I don't have any. No.
Okay. All right. I think this concludes our assessment today.